When the patient wakes up and you say, hey, I look down your stomach, it just looks great, and we did a colonoscopy and it just looks great, and they say, I've still got gassy, crampy abdominal pain, what do you think of? What do you do then?
So then I would say, let's talk about other possibilities. Let's talk into trying different remedies, and let's talk into your diet first. Let's say, what's your usual diet? What do you eat every day? And then we start to correct their diet habits.
So what are some of the bad things that people do in their diet that you say, you know, we really need to start off, is it better to skip a breakfast? Is that the best meal, most important? What do you do lunch and supper?
So that's a great question. Breakfast is crucial. We always ask them to eat a protein-rich breakfast. It's very helpful. There's lots of growing evidence on this. Then I usually ask them to eat small, frequent meals throughout the day. And I usually recommend 5 to 6 meals.
So give me an example for breakfast, and then if you're going to eat 5 meals, you have to have another meal around 10 o'clock. What should a high-protein breakfast be, John?
So they can do 2 to 3 eggs with a little bit of oatmeal and maybe some healthy nuts like shredded almonds and stuff like that. That's a great breakfast.
So almonds and sometimes oatmeal and sometimes eggs. I'm hearing protein and fiber. Is that right? Is that important?
Absolutely.
So what do we do around 10 o'clock? I'm getting hungry again, but I had a lot of protein, so I don't get hungry too fast.
So that's a great time to take a little snack, or what we call it meal replacement. Yeah, so it could be a little bit of protein shake. It could be a couple pieces of a turkey. Could be
just anything with protein.
Sure.
Lunchtime, can we have a salad bar and put all the stuff on it, or is that the worst thing anybody could do?
No. we can't do that.
So give me an idea on lunch. What should we do again? If somebody is, it's 12 o'clock noon and they want something in their tummy, and nature tells them, I want something in my tummy. What do you recommend then?
So that's a great time to have another nice meal. Salads, green vegetables, steamed vegetables are great. Then a good piece of a good protein. We usually like to avoid red meats and processed meats a lot. So we ask them to do either chicken, fish, some soy-based protein. Sometimes we do seafood. Beans are good. So, but in moderation. I usually ask them to eat a small lunch.
Is that a key?
That's a key.
Moderation.
That's a key.
Do you need to sort of, how do you tell them moderation? You know, the plates are getting bigger. You go to a restaurant, they stack it high. So what do you tell somebody? What's a good portion, for instance, of beans and lettuce?
So there's a lot of tools to measure how much patients should eat. You know, you can measure on your fist, on the plate, a cup, and so forth. I usually ask them, what have you eaten before? Just eat half of that on that lunch.
It's a great thing. You don't have to concentrate so much on the fad diets, but you just cut down on what you're eating. So before supper, somewhere in the middle of the afternoon, and then supper, you sort of follow the same pattern. Give me an example of supper.
Before supper, I usually ask them to do like a Greek yogurt, or like a little bit of cottage cheese with fruits and vegetables. And that will be about 2.5 hours after the lunch, 2 hours before their supper, before their dinner.
You're really putting somebody on a good diet. Is that following a Mediterranean or a DASH diet, or that's just good eating?
There's a lot of diet being tried in the past. A Mediterranean diet, DASH diet, which is a diet aims to stop hypertension. Low-fat diet, low-carbohydrate diet, paleo diet, plant-based diets. All diets work, Dr. Bob. It's about how patients really follow diet and how willing they are to stick into it. That's the key.